Beyond malaria cause of fever in outpatient Tanzanian children. Malaria. Definition. Is an infectious disease caused by protozoan parasites from the Plasmodium family that can be transmitted but by the bite of the Anopheles mosquito or by contaminated needle or transfusion. Falciparum malaria is the most deadly type. Symptoms. The initial symptoms of malaria are flu-like and include fever, headache, sweats, chills, and vomiting. These symptoms are often mild and can sometimes be difficult to identify as malaria. Applications in medicine. Epidemiological bias. Investigators use an standardized case report form in which items relevant to a febrile presentation were listed. 23 symptoms are their respective durations: travel history, contact with sick persons, no chronic conditions, and 49 clinical signs. Diagnosis. In all cases, blood samples 5 ml and pool nasal and throat swabs were collected for microbiologic testing, cultures, and rabies tests on-site and further serological and molecular analysis in Switzerland and the United States.
This is Jeffrey Drazen for the New England Journal of Medicine. In Dar es Salaam, the 3-year-old boy wakes in the night, calling out to his parents. His mother lays her palm on his forehead, which is burning. She applies a wet cloth to his head and sings to him until he is asleep again. I'm worried it's malaria, the father says. 2 days later, the boy's fever has not resolved. The mother brings her son to the clinic. Is it malaria? She asks the doctor. Doctor shakes her head. It might be something else, she says. Let's have a look. In many parts of Africa, malaria transmission is declining. Now that there are point-of-care, rapid diagnostic tests for malaria, healthcare providers face a new and daunting challenge. If a malaria test comes back negative, what might be making this child sick? what is the appropriate course of action? In a study reported in the journal, the etiology of fever was investigated in children in Tanzania. Just over 1,000 children under 10 years of age and with a fever of 38 degrees Celsius or higher were recruited at outpatient clinics. Blood samples and nasal and throat swabs were taken. Within an hour, malaria and a number of bacterial illnesses could be ruled out. With this information, initial treatment plans were formulated, and if indicated, treatment was started. These plans could be modified when additional results became available, usually within 5 days. The final diagnoses for the cause of fever, such as malaria, upper respiratory tract infection, pneumonia, systemic infection, or gastroenteritis, were determined through algorithms using pre-specified criteria and were not available in real time. A possible etiology of fever was identified in almost all the children. It was a virus more than 70% of the time. For the febrile child in a third world setting, once malaria and tuberculosis have been ruled out, if there are not strong clinical indicators of a bacterial process, these data provide reassuring epidemiological evidence that it's okay just to follow the illness and not to treat with empiric antibiotics.
Pros and cons. Pros: who recommends artemisinin-based combination therapies (ACTS) for the treatment of uncomplicated malaria caused by the Plasmodium falciparum parasite. There are some drugs that can be used 1 or 2 days before traveling to places with malaria disease such as doxycycline. Cons: its medication makes the skin more sensitive to the effects of the sun. Doxycycline can be used in children under the age of 8. Mefloquine has no use in children with heart disease.
The monsters inside me. Malaria is caused by a tiny parasite called Plasmodium. Once inside the host body, the Plasmodium parasite enters individual red blood cells. There, they multiply rapidly and eventually break the cell apart from within. And legions of new parasites re-enter the bloodstream and start the attack all over again. This cycle of destruction repeats every 48 hours.
The reason that people who have the malaria parasite get these fevers that come and go is that the parasite spends part of its a huge response, and that's when the fevers happen.
The parasite is transmitted from host to host by an insect, the mosquito. It's then move back into the bloodstream and attack red blood cells. When a mosquito bites someone with malaria, the parasite enters the insect and the cycle starts again.
Applications in Ecuador. Prevention. The parasite can become resistant to certain medicines. Doors, windows, and other possible mosquito entry routes to sleeping accommodation should be screened with fine mesh netting. Conclusion: in Ecuador, the humid conditions from the winter let the mosquitoes reproduce. If the mosquitoes' replication cycle is stopped, the malaria number of cases will reduce.
Old Grace Abba has malaria. For 2 days, her mother has been giving her medicine brewed from herbs and bark. According to the World Health Organization, malaria claims the lives of over 270,000 children.
If the population has not access to this drug, then of course it will not have an impact on the disease.
The malaria parasite's life cycle is very complex, involving many stages. Cell and journey back toward the bloodstream. They then infect healthy